I'm Joe Augustinelli, Social Media Manager at Greenway Health, and this is Putting Possibility into Practice, the podcast from Greenway Health. And we are discussing our Customer Advisory Board for Project Polaris, and it met ahead of our annual event, Engage 2018, our annual customer event, which just wrapped up in the Washington, D.C. area, National Harbor, Maryland, to be exact, over the weekend. And part of that, actually, before we got started with Engage, our Customer Advisory Board met for the third time. And I welcome a couple members of the Customer Advisory Board to today's episode to discuss the progression of the Customer Advisory Board and what they're looking forward to over the development time span of Project Polaris. First, from Mercer-Bucks Orthopaedics in Pennsylvania is Tony Molchany. He is the CEO of Mercer-Bucks. And Tony, thank you for taking time to join the podcast.
Joe, thank you for inviting me to this event and to participate in this podcast.
Let's talk a little bit about the practice first. Why don't you just let us know a little bit about your practice that you're with, who you guys serve, where you're located. I mentioned Pennsylvania.
Sure. Joe, we are located in about an hour north of Philadelphia in our Pennsylvania market, and in the New Jersey market we cover a number of locations from Trenton to Lawrenceville to the Princeton market. We have 6 locations, approximately 45 providers, and service that area of central New Jersey to the lower Bucks, Pennsylvania market.
So 45 providers, quite a big practice. Talk a little bit about your involvement on the Customer Advisory Board and what it means to you to be part of this Customer Advisory Board for Project Polaris.
Sure. The opportunity to participate with this board really gives a very positive approach on allowing me the opportunity to contribute some valid points or direction to Greenway and where their product is going and the design. It's instrumental that Greenway listens to its customers, and it's very positive to be a part of that team to provide feedback that is necessary for the future of both directions of Greenway and what they contribute to the organizations that they serve, not only mine, but the many other practices, and helping set direction of the future, because the healthcare market is constantly changing, and unless we have a great partnership and projection with Greenway, you can easily fail in this market.
And with that ever-changing market, the development process for Project Polaris underway. First met in May down in St. Petersburg, Florida, and then a meeting in between that one and this in-person one. So now 3 meetings of the Customer Advisory Board. And just talk a little bit about the progression that you've seen since May until this time and your thoughts on how this weekend's meeting went.
I believe the team now is really getting together. People are on the same dynamic, and people are getting more comfortable with exchanging information. As our 3rd meeting has rolled out, there's a certain level of comfort zone in the mini groups and different sessions that we've held together. And there's consensus amongst members. It's just not talking about one subject matter. It's really trying to provide direction, and you can see the unified team now coming together and providing some substantial feedback to Greenway on some positive trends and what will work, and talking about shaping Project Polaris to the next level.
And in talking about shaping it to the next level and preparing, of course, we can, as you mentioned previously, we can never know what the next emerging healthcare trend is going to be, but how do you think Project Polaris can help with the challenges that providers face in this healthcare digital age?
What I see is the significant value of Greenway looking to the next generation, the next shaping of what's important, what's going to set the direction for the future. You're taking a product and really rebuilding it and using solid customer support and feedback to reshape the product of the future. I think that's just simply critical, and I applaud Greenway for taking the opportunity to put this board together and then take the information that they're obtaining and use it to everyone's advantage. It's really important that Greenway and the practices be on the same page and have a relationship that they're driving together to meet the mission of the organizations that they serve, because it's important with the ability to survive in this day and age. You have to have a really good strategic partner.
And finally, Tony, what are you looking forward to the most as we continue down this development process?
The complete rollout of this package, Project Polaris, and how it's really going to reshape the market of the future. Blending some of the items that were discussed in our breakout sessions and building upon that to concentrate on, wow, there's a number of next steps that are going to have the ability to really drive the organization to more success, reducing some cost, being a significant player in the market with what we're able to accomplish.
Well, thank you, Tony, for taking time out of your busy day to discuss the Customer Advisory Board meeting here on our podcast. And as we go along this process, we're certainly going to keep in touch and get your thoughts as we continue down this development process. So I thank you for taking the time to meet with me today and discuss Project Polaris and the Customer Advisory Board.
My pleasure, Joe, and it's been a pleasure to spend my time and taking a few minutes to chat with you.
Sounds good. That was Tony Molchany, Mercer-Bucks Orthopaedics in the Pennsylvania area, a fairly large practice, 45 providers, and Tony is one of our members of our Customer Advisory Board for Project Polaris. As we continue with our Customer Advisory Board, we'll continue to provide updates on Project Polaris, and we look forward to catching up with Tony after a future meeting. We will now welcome another member of our Customer Advisory Board for Project Polaris from Treasure Coast Community Health Center, Sherry de Cuba. We had met up at HIMSS in Las Vegas right when the podcast was launching, so she's a pro at this, so welcome back to the podcast.
Thank you. Happy to be back.
And Sherry, first, for those who may not recall from way back in March, here we are at the end of summer now. Talk a little bit about Treasure Coast and the practice and the providers.
So Treasure Coast Community Health is a federally qualified community health center located in Indian River County in Florida on the East Coast. We are family practice, pediatrics, gynecology, behavioral health, dental services, and somewhat of social services, as all community health centers do. We are, I guess, a medium-sized facility. We have 7 locations and see around 20,000 unique patients each year.
And with so many patients and 7 locations, you're a member of our Customer Advisory Board for Project Polaris. So first, let's talk about being a part of that Customer Advisory Board. Now the third time, as I mentioned, that you have met. What does it mean to you and your practice to be a part of this advisory board?
Being part of the advisory board is a privilege and an honor to be one of 19 people who are helping to shape, I guess, the future of Greenway for all of us with our EHRs. It is an opportunity to give our ideas from not just our perspective, but from those people we work with, our providers, our clinical support staff, billing, administration. Greenway is being very proactive and looking towards how healthcare is changing in the future and taking the input from their current users in all 3 of their platforms. And that is what we've been together discussing each of our times together on the board.
And this is now the third time that you guys have met, the second in person and obviously one over the phone. Since that first meeting in May, the progression so far and your thoughts on how things have gone in the last few months?
It's progressed very well. This meeting that we had in person was excellent. We have all gotten to know each other. We know everybody's names now, what type of practices we're from. So we're more comfortable. We are sharing all of our thoughts, our ideas. We also are fortunate enough to have a person who sends us out homework and gives us things to do, which is a great thing because then, as I stated a little earlier, you're not getting just my view of the product. You're getting the view of everybody at my organization because I'm going to take the homework and go and meet with my super users, my trainers, the folks that really work day to day in the product, and bring back their suggestions of how things could be a little easier to use, a little more function to it, anything that'll help.
With the continual changes to healthcare, what type of challenges can Project Polaris and a next generation platform help with what providers are facing in healthcare and in this evolving digital age?
So as many people probably read, you hear all about physician burnout. We've taken our paper charts, put them into electronic form, and with that comes a little less interaction with the patient. And so that's a little harder on our providers. They're that eye-to-eye contact, hands-on. They're spending more time in front of a computer. So with Project Polaris, I see that as a way to develop a better product for the providers so that they enjoy medicine and then they enjoy seeing their patients and aren't so worried all the time about the clicks and the boxes and all of those other things that take a little bit of the joy out of their day.
And looking ahead, and I know it's hard to do, especially in the healthcare industry, but looking ahead, what are you most in anticipation of or looking forward to as the development process continues?
I'm looking forward to seeing how it looks, how it has a more intuitive feel to the product, that we all enjoy, some of us enjoy being on our smartphones and our tablets, and the parts of those things that we like to use on our smartphone, we should enjoy using on a computer every day when we're working as well. So I think those changes will make a huge impact overall with our providers and our end users.
Alrighty, I want to thank Sherry de Cuba of Treasure Coast Community Health, one of our guests here and a member of our Customer Advisory Board. Thank you for taking time out of your day to join us for this episode of Putting Possibility into Practice.
You're welcome, sir.
We'll catch up again as the Customer Advisory Board continues to meet and the development process continues to go on Project Polaris. Sherry de Cuba from Treasure Coast Community Health Center in the state of Florida. For more information on Project Polaris, I invite you to visit our website at www.greenwayhealth.com. Thank you for listening to this episode of Putting Possibility into Practice, the podcast from Greenway Health. I invite you to subscribe on SoundCloud, Stitcher, Google Play, and the Apple App Store. Thanks again for listening. I'm Joe Augustinelli, the Social Media Manager at Greenway Health.